Well, there is still widespread inequality, actually disparity in Uganda right now, in the area of health, for instance, especially when it comes to access of healthcare. We know that in parts of the country, accessibility to healthcare is just about 10% of the population live within a walking distance of about 5 kilometers to any public health facility. The northern part of Uganda is an area which has been affected by war for so many years. So people have been living in camps and they're still getting back home. So most of the people don't really live within a short distance to a health facility where they can quickly get help. Whereas around the capital city is about 100%. So there's a very widespread inequality. And the average is just about 50%. And that has been a marked improvement over the last 6 years from about 43. So it's still much. And then, of course, that is also seen in terms of the health outcomes, infant mortality rate, and the prevalence of illness in the population is still markedly varied across the country. And it's not only that, in terms of financial accessibility per se, even where the services are available, they have to spend a lot on healthcare. If you look at the total expenditure on healthcare, about 60% of that goes into transportation in order to access healthcare. So that in itself makes actually access very difficult even where the facilities are available. And so much of these that we see, these barriers to accessibility, tends to affect some parts of the countries much more than others. And we are talking more of the northern part and the northeastern part. Interestingly, those are the areas where actually Cuamm is concentrating in. The total healthcare expenditure right now in the country, it could be something like 20 US dollars per capita per year. We're talking of total private and government. Then out of these, about 12 US dollars is of public sector. And then out of this public sector, we are talking about maybe half of that only is from the local tax. So it is still very low. And what is required right now is that we need about 28 US dollars per capita per year as an adequate amount of investment. That is if you don't include HIV, ARVs and other vaccines for pentavalent vaccines. If you include ARVs and pentavalent vaccines, we need about 32 US dollars per capita per year. So therefore, if you compare the required amount of money and what we are investing as a government, it is way down. It's less than 30%. And to make matters worse actually now, there is what they call a budget ceiling. There is a ceiling on the level of expenditure that the government can invest as a way of fighting inflation and restoring macroeconomic stability. And because of that, government expenditure on health has been capped. Instead of going up to 15% of the Abuja target, it has been capped and is slowing down. So in terms of equity, the future definitely is very bleak, because the fact of the matter is that most of the disadvantaged people would benefit more from publicly funded services. So if we are cutting expenditures on that, then you can imagine what's going to happen for the poor people. So as a result of that, most of the poor people now have to rely on private not-for-profit organizations that have to look around for donation from foreign countries. And that is why an organization like Cuamm is doing a great job by trying to support such organizations that are trying to provide services rather privately, because they are located really where the disadvantaged people are. Well, I think one of the biggest problem for a physician is, first of all, the fact that you have so many people to handle. The patient-doctor ratio is very, very high, and quite often you probably are unable to help the person because you don't have the facilities that you do need. And this gets very, very frustrating for a doctor. So to motivate a doctor, you need to be able to make sure that you have the implements that this person needs, okay? So that is at the level of practice. But also, it would have been very important to be able to provide further training for doctors, training that provides solutions to the kind of challenges that they meet in those kind of settings.